Well, because we're using the AqueCool system, you do get not only faster healing, but you get, a better scar because you are keeping out the inflammatory response. So, if you're the zone of injury, from burns, we know that if you have a little bit of a burn, and certainly, the fractionated CO2 is a little bit of a burn, you will get quicker regeneration of the skin using cool therapy and AqueCool. It just decreases the inflammatory response altogether, so that if you were ever worried about an area having a problem, that maybe the burn was too deep or that you might get hypopigmentation, certainly putting the AqueCool on that minimizes that quite a bit because it decreases the tissue needs so that the metabolism isn't going so fast, and so you don't increase the zone of injury as much. So honestly, it's a safer way to treat patients as well. The patients like the AqueCool best because of the pain relief that they get from it. It just, they don't have the itching, they don't have even people that are claustrophobic, generally speaking, when they try to take it off for a while, they find that they put it right back on simply because of the decrease in pain and the good feeling that it gives them. And, they can't see the decrease in inflammation, but certainly that's a great byproduct of the cold therapy that they get that advantage from. And so the swelling goes down so much faster. We find that it really goes down faster, probably by 25–30% rather than using the ice and so on. So if it would usually take the swelling 3 days to 4 days to go down, it's going to be down in like 2.5 to 3 days, something like that. So it's a marked improvement in the amount of swelling, probably because compliance is better.
Cold therapy actually makes the patient's operative site feel better for the patient. That's the primary reason. There's some scientific evidence that you can optimize healing with temperature differentials. I'm not sure how much of that I buy into, but my patients all just seem to like the cold therapy, and they always have. My standard used to be to pack the patients in Ziploc bags full of frozen peas. That seemed to work. I guess it was cumbersome, but it seemed to work, and we've used cold forever. Well, the patients love it. I mean, I was a little resistant at first when AqueCool first came out. I thought it might be a little too bulky, too difficult to use, but it turns out that's just the opposite. So I'm a convert, and every patient we've used it with has raved about it. And in fact, the most recent one went out of here yesterday after eyelid surgery, and she's very happy. She said the pain went away, and she's doing well. I think they like the relative convenience of being able to put the garment or the mask on. If they've got to get up, all they have to do is disconnect the snap connectors, and they're on their way. One patient that had the AqueCool breast garment specifically said that she felt that rather than having, bags of ice strapped to her chest, that she could move about more readily. So it's a convenience thing, I think. Do I find that patients are willing to pay the extra for the AqueCool product? I thought that would be a big impediment, but it turns out it's not. But then again, I think that's a structured response. Patients who are having facial cosmetic surgery are usually, in the older age groups, not old people, but older, and money doesn't seem to be that much of an impediment to them. From the data I've seen, it appears that it does improve the post-operative course, yes. And I think the best response to that is that we are offering it to all our patients now. What I've found about the AqueCool system is that we can put it on the patient on the operating table as soon as we're done. So we know that they're having cold perfusion from that time on. Whereas with bags of frozen vegetables or ice chips or whatever, I mean, there's no way they can put those on and go home. It's just not going to work. So that I think we're getting a quicker application of the cooling, and the information I have is it's pretty continuous. The patients are pretty religious about using it, at least for the first couple of days. I was so impressed with this after the first few patients that I sent an email to all my colleagues in the profession said, give it a try. I mean, I rarely endorse something to that degree. So I'm a happy camper.